So I have followed all the doctor's instructions, have taken all the supplements recommended before and during pregnancy, but I still experience miscarriage. These are some of the many questions that women have, and today those questions are going to be answered. Joining us in this show is Dr. Edward Sang, a renowned gynecologist here in Nairobi, Kenya, and he'll be telling us why do we see so many miscarriages, what are the possible causes, and most importantly, what can I do as a woman to prevent this? If this episode is going to help you in any way, or you know someone that might help, then remember to subscribe and also share. My name is Purity Nzuki. Welcome to the show. Daktari, thank you so much for joining us. Maybe I'll just welcome you to introduce yourself, tell us where you're based, and I know there will be so many questions from ladies out here, and even husbands and brothers. How can they get in touch with you?
Okay.
Yeah.
So I'm based at MP Shah Hospital at the Doctor's Plaza. So I'm here on weekdays, usually about 10 to 3 o'clock, and they're welcome to visit.
All right, thank you so much. So I don't want to ask what a miscarriage is, because many women have experienced it, loss of a baby before the baby is born. But you can, yes, define what a miscarriage is, because there are some things that happen and they're not miscarriages. I'm not sure. But the main question is, why are they so common currently?
Yeah. Well, yeah, it's a common occurrence. And if you ask ladies, they'll always have, some of them will have had 1 or 2 miscarriages. And so it's also a way of reassuring ladies who get a miscarriage that it's not the end of the world. The next pregnancy is most likely going to be normal. So it's very rare to have a lady having more than 1 miscarriage. And so usually if a lady has just 1 miscarriage, then we are not so worried. We reassure them. And most of the time, the next one is okay.
But if now they have 1, because I've seen ladies saying, I've had 1, I've had 2nd, 3rd, and I'm literally giving up on trying having kids. Then what could be the problem?
Yeah, so a miscarriage is a loss of a pregnancy in early pregnancy, usually in the first trimester or the first 3 months. So this is a pregnancy which starts okay, grows, and then suddenly comes out. The commonest cause is actually a chromosomal problem. So at fertilization, something goes wrong. And so yes, it's a pregnancy, but it's not normal. So it grows for a while and then dies. And then if a pregnancy dies, then the body removes it. So that is the commonest cause. At times, you may not be able to change, because this is something which happens beyond your control. When the sperm and the egg meet, when the chromosomes are joining, some of them don't join correctly. And so the baby doesn't form well. So at some point, it comes out. There are also other miscarriages which occur later on, which we call mid-trimester miscarriage.
So now the ones for chromosome, they occur between what?
Usually before 12 weeks.
Okay.
So those ones come out before 12 weeks, and we let them come out. We don't do much. They are now the ones which come later on, like maybe 15, 18 weeks, 20 weeks. So the baby has grown a bit, and then something happens that usually the cervix gives way, or usually it's something wrong with the uterus or the cervix. So it's not the pregnancy now, it's not the baby. So the baby is growing well, then suddenly the cervix, which is supposed to hold the pregnancy till 9 months are over, gives way. So it opens up, and then the baby comes out. Usually it starts with, like, the lady feels water breaking, and then the baby comes out with labor. Sometimes not so painful, sometimes a bit painful. Then others, maybe the lady has fibroids and within the uterus, and then so the baby grows to a certain age and then comes out as well. So those ones we can try and maybe prevent that by maybe doing a stitch, a McDonald's stitch, holding the cervix till the baby is grown enough. Then we can remove it, so that even if labor starts, the baby has grown enough. Yeah.
All right. And you've mentioned that before 12 weeks, it's chromosomal.
Yes.
So there's nothing much you can do. Is there any known cause for why the egg and the sperm just fail to cooperate? And
sometimes one of the parents has a problem. They may have a genetic or chromosomal problem, which now the pregnancy has. So some of the pregnancies will have that chromosomal problem, it will not grow. But some will be normal, and so they'll also have children who are normal. The other thing which I have not mentioned is that when a lady has recurrent miscarriage, that they have occurred more than once, then now we also do other tests, like mainly for infections, which we give the acronym TORCH or TORCHES. T for Toxoplasma, rubella, then cytomegalovirus, and then herpes and syphilis. So we do those tests also for a lady who has had recurrent miscarriage, because she might have one of those infections which needs to be treated. So if she doesn't have any of those issues, then we just try again and see, and most of the time it goes well.
And because there's a lady who can have a miscarriage before 12 weeks, that you said it's chromosomal.
Yes.
So is it possible that the same lady, like I've had a miscarriage before 12 weeks, then the next pregnancy is okay? So does it mean the chromosome somehow sorted itself?
Oh, yes.
Yeah.
So it's just that the one where she had a miscarriage, the chromosomes had a problem.
Okay.
And it occurs once in a while. Then the other one is normal. So the chromosomes now join correctly, and now the baby is okay. As an example, there are those babies who have Down syndrome, which is a chromosomal problem.
Yeah.
And you might find that there might be just one child in the family with Down.
Yeah.
Then the others are okay.
Yeah.
Meaning the other children, the chromosomes were normal. So that means, it doesn't mean that all the pregnancies will have that problem. Yeah.
So between miscarriages before 12 weeks and after 12 weeks, as an expert, which ones do you say are more common?
Usually the ones before 12 weeks.
Okay.
Yeah.
Yeah. So let's not talk about the prevention, like, and not even just, let me stay with the cause, especially for after 12 weeks, because those are some things that can be prevented. You mentioned fibroids, for example.
Yeah.
So maybe you can just in detail break down for us what are the possible causes of miscarriage, especially after the 12th week.
Yeah. So mainly, actually, it's the cervix or the uterus with the fibroids. In other words, it's an anatomic problem. So the structure of the uterus has a problem. So the baby is normal, the chromosomes are normal, the baby is growing, then the cervix gives way. So that is a common one we see once in a while. So for those ones, we now put what is called a McDonald stitch around 13 to 17 weeks. In other words, we allow any miscarriage, any pregnancy which is not normal, to come out first. Because we know now pregnancy which has passed 13 weeks generally is a normal pregnancy, no chromosomal problem. So we don't put the stitch at the beginning. We wait till about 13, 14 to 17 weeks when the first trimester is over. Any abnormal pregnancy has come out. So the one which has passed there is usually okay. Then now we put the stitch. So we take the lady to theater because it's quite a painful procedure, put her to sleep. Then now put a stitch to close the cervix. So that stitch is strong and holds the cervix for the 9 months. Then when we reach a certain gestation, when we feel the baby is ready, then we can remove the stitch.
Yeah.
And then now she can deliver.
So there are so many questions on women being advised to take some supplements which could reduce the risk of, for example, having abnormal formation during the first 12 weeks and also miscarriages. Maybe you can take us through that, because most of the time I've had so many women, even for me, of course, I have a baby. Folic acid was my friend. So let's talk about these supplements or any things that you recommend that women should take before and even during pregnancy to reduce the chances of miscarriage.
So usually when a lady is planning to get pregnant, we usually advise them to use folic acid for a month before getting pregnant. Usually because when a baby is conceived, the baby uses up a lot of folic acid. So if the mother does not have enough folic acid, the baby may have congenital anomalies. Usually they would not really miscarry, but the baby might have what we call neural tube defects, where they can have on the spine a space. So the bones don't form well, and there might be a space at the back of the baby, and some even have some hair there, and some even have some bulging of the spine or the contents of the spine. So you can see some like a growth at the back of the baby. Usually that's because of lack of folic acid.
So in other words, from what I'm getting from this conversation, low quantity of folic acid in moms, is it not the biggest contributor of these birth defects that we are seeing? Maybe you can address babies born with Down syndrome, babies born with autism. Can those conditions, are they linked to low folic acid?
No, not all of them.
Okay.
Maybe just the ones where there's an issue on the spine, on the back, or the neural tube defects.
Like, for example?
So usually a baby might have like a growth on the back, okay, on the spine. It's not so common, but we do see sometimes, and that is usually because of the folic acid. Autism and Down syndrome are slightly different, and at times not even so well understood as far as autism is concerned. For Downs, we know what the problem is. The chromosomes do not join up together well at fertilization. And so, and it occurs mainly in ladies who are over 35, because the eggs, we say the eggs are a bit older, and so those chromosomes may not work as well as in a younger lady. So that is now when we do get Down syndrome, which is age-related and chromosome problem, not really folic acid. The other thing about supplements is that there are some situations where we give progesterones in early pregnancy. There's not everyone agrees on that. Some doctors feel it works, others don't feel like it works. But we generally give them because some people feel like the progesterone in the body is not enough to sustain the pregnancy. And so we supplement progesterone. As far as these other supplements, that multivitamins that we give in pregnancy and calcium, again, the benefit may not be so strong. Some ladies like, so personally I like to give patients the option whether they want to use them or not, because it has not really been shown that if you use them, the baby will be better than the one who never used them. That's as far as supplements are concerned. So again, I think we have to look correctly so that we don't have ladies using medications which are not necessary. Some of them are a bit expensive.
And as we wind up, maybe what can I do? Is there anything I can do to lower the risk of miscarriage?
I think generally having a checkup before getting pregnant. We do find ladies with very large fibroids and they never knew. So at some situations we can advise them to first remove the fibroids before getting pregnant. And if she has had miscarriage before then we can make an effort to save the next pregnancy. Unfortunately, we might only be able to act if somebody has had a miscarriage, because again, we cannot be able to predict. Like if a lady is pregnant for the first time, we cannot tell if the cervix is strong enough or not, or whether she'll have a miscarriage or not. So we always give somebody the benefit of the doubt to try first.
Even with the fibroids?
Even with the fibroids, because we do get ladies getting pregnant with fibroids. Then now if something happens, then now we can deal with it. And you see many of them, even with the fibroids, will have a normal pregnancy and deliver at the end without a problem. So it doesn't mean we just remove fibroids just because they are there.
All right, Doc, thank you so much for educating us. Especially for me, I've learned that the miscarriages that occur under 12 weeks, it's chromosome related and there's nothing much. But after 12 weeks, there are possible causes, and it's good for someone to get checked. Something else I've learned is that if you've had more than one miscarriage, then there could be a cause or trigger for that. So just rush to the hospital, call your gynae if you have, and get checked and get treated, because you can still get pregnant. All right, thank you so much. I'm a good student, right?
Yeah, exactly.
Okay, and we've been speaking with Dr. Sang on miscarriages, and I hope your questions have been answered. And please share this with a sister, with a mom, and a friend, because we need to understand, as women, we need to be empowered and know what we can do really to empower ourselves and know much about miscarriages, so that we don't give up on having babies if we really want to have them. I'll see you on the next episode. My name is Purity Nzuki. Bye bye for now.